So good morning, ladies, gentlemen and colleagues. Welcome to the University of Queensland and to our Health Matters session on passion and purpose, an exclusive conversation with leading women's cancer researchers here at UQ. Thank you all for joining us. I'm Professor Marina Reeves. I'm a breast cancer researcher in the School of Public Health and I'll be the moderator for this session today. Before we begin, I'd like to acknowledge the traditional owners and their custodianships on the lands, on these unceded lands on which we meet, and pay our respects to elders past, present and emerging, and acknowledge their continual connections, cultural and spiritual connections to country. We'll get our tech issues sorted soon. This land had always been a place of teaching, learning, knowledge generation and healing. I want to acknowledge that this week is 1 year since the Voice referendum and acknowledge that it's been a very difficult time for our First Nations colleagues, and I, like many of my colleagues and the 6.2 million other Australians, stand in solidarity with our First Nations people on this path to truth-telling and reconciliation. Some housekeeping matters before we kick off. So in the unlikely event of an emergency, please follow our staff who will direct you to the exits. Bathrooms, should you need them, are on either side of the stairwell and the lift. Please put your mobile phones on silent. And finally, if you'd like to post it all on social media, please use the hashtags UQ Health Matters and hashtag UQ Giving Day. So I'm going to start by introducing our panel. We have Vanessa Bean, Professor Carla Solomon-Gallo, Professor Amy McCart-Reid, Associate Professor Amy McCart-Reid, I just gave her promotion, Jeff, and Associate Professor, but soon to be Professor, Fiona Simpson. So this year, approximately 21,000 Australian women will be diagnosed with breast cancer, and about 7,000 women will be diagnosed with gynaecological cancer. Now, most of you will know someone, whether it's yourself, mother, sister, auntie, grandmother, friend, partner, wife, who will receive this diagnosis this year alone. For most women who are detected early, their survival's high, but many of them will live with the ongoing effects of their treatment for many years even after their treatment ceases. And they'll also live with an ongoing fear that their cancer is going to return. For other women who are diagnosed late or where their cancer comes back, their outlook is very different. Their treatment never ends. They'll continue to undergo treatment, and the impact of that on their life, on all aspects of their life, is significant. 20 years ago, my mum was diagnosed with metastatic breast cancer. I still remember the day that I found out that news, the days that followed, where we then found out that cancer had spread to parts of her bone, and every part involved in her journey. Now, she lived in a major city. She had private health. She had no financial stress. She had a daughter who was a dietitian, a researcher, and her biggest advocate within the health system. So you would think she had a lot of things going for her. But watching her over that 4.5 years fight that battle with that disease to the very, very end was absolutely heartbreaking. My goal and what I would love is that we have a world where no woman's diagnosed with breast or gynaecological cancer. I would even love a world where all women are diagnosed early and they're treated effectively so that no one has to live with the fear of recurrence. And I would even settle for a world where all women who are diagnosed with metastatic cancer still live long, full lives with good quality of life. Now, my guess is that most of you have those same hopes, and that's why you're here today. So what we're going to do now is talk to our panel, and they're going to share with you the research that they're doing at UQ to try and achieve those goals. So, Vanessa, we're going to share mics. But you work closely with a lot of women facing gynaecological cancer who you see their experiences firsthand. Can you share with us what that's been like?
Yeah, it's on, sorry. It's a terrible journey. I've been nursing in gynaecology since 1998, and one of my first and worst experiences in research was a patient was offered a clinical trial whilst on the ward, and a senior nurse told me, well, they're offered a trial, there's no hope for them, which is clearly not the case. Evidence shows us the reason we do research is to find better treatments for these women and hopefully kinder and gentler treatments. But the most important thing that I've seen with women is a lot of people don't understand their own bodies. They need to know their parts. Don't be embarrassed. It's not taboo. It's not something you shouldn't be talking about. Speak up. Do not be brushed aside. If you get an opinion you don't like, get it a second opinion, get a third opinion. And that's what we've seen in research and with the women that I've been taking care of through clinical trials and nursing on the wards, is that we just need to talk about it. It's not something that should be kept pushed aside and no one talks about because it's embarrassing. We've got to stop letting it be embarrassing.
Thank you, Vanessa. That's a really important point. And, one that I hope we all take away from here is around the need for women to advocate for themselves. When you do think that something's not quite right, and if you're not happy with the opinion you get, keep advocating for yourself and get other second opinions and ask for referrals. We know that delay in diagnosis, particularly some of the work we're doing here in the School of Public Health around vulval and vaginal cancers, is a lot of women will have delays in diagnosis because they're told they're too young and it couldn't possibly be cancer. Carlos, the work that you're doing, we know in ovarian cancer, one of the biggest problems is that women are diagnosed late. And so, over the last 40, 50 years, we haven't really seen any improvements in terms of survival because they're still being diagnosed too late. Can you tell us about the work that you're doing and the impact that that's having?
Thank you, Marina. And, that's loud, yeah. And good morning, everyone. So thank you, everyone, for coming this morning. It's really great to see everyone and great that you can donate your time, actually, and amplify, with your network, what we do. Yes, I work in ovarian cancer, and probably everyone have heard the nickname for ovarian cancer, which is the silent killer, right? Which give you a lot of information about how scary this disease is, right? My research focus mostly in early diagnosis, because this is something that hopefully you can share with everyone after this meeting, is early diagnosis save life. And this is the main area of research of my work. So how we can identify these women in early stage of ovarian cancer, because we can provide them opportunity to fight this disease, right? One of the main issues with ovarian cancer is because there are no specific symptoms. Usually when the clinical symptoms start, very general clinical symptoms, back pain, stomach issues, women need to go to the bathroom probably more often, right? They identify that it's already stage 3 and 4, right? Which is already metastasis, in which we know that the survival rate of this woman is probably around 20%, which is completely different if you are able to identify this disease in early stages, in which the current treatment and surgery actually work very well, and the survival rate is over 90%. So my research have been focusing, and I'm just one of the researchers working on this, in how we can identify these women as early as possible, right? The other problem with ovarian cancer is, even though we all agree that we know more now than what we knew 50 years ago, that unfortunately that does not reflect in a better survival of these women. Just to give you an example, the survival rate of women from ovarian cancer 50 years ago was around 40%. Currently it's around 43%. So you can see that even though that our technology is better, we have more tools now, that is not reflected in a better survival of these women. So we need to be able to identify better biomarkers for ovarian cancer to trying to avoid the identification of these women at late stage. And I'm going to finalize with the second issue with ovarian cancer as well, and I'm trying to not be specific here, is in compared with other cancer, the majority of the cancer start from inside out. So, for example, you have a cake, right? So in the middle of the cake, you have layers, right? It takes time from the middle to just go to the different layers. So cancer is very similar. So you have something in the middle, which your cancer cells, and they start to grow and go to the surface and then spread. Ovarian cancer starts in the surface of the ovaries and the fallopian tube, which make very difficult to identify, but also they spread very quickly. And that is the main reason that it's very hard to identify women at early stages, and the majority is just a late stage of ovarian cancer.
Thanks, Carlos. And really important why, highlighting why that need to detect those cancers early. And early detection is great, but we then need the effective treatments to be able to treat that cancer. So Amy, if we think about breast cancer, breast cancer has been one of the most research studied cancers in the world, but it's not a single disease. And so the best survival gains that we've got from this research is in the most common breast cancer, postmenopausal women, hormone receptor positive breast cancers. But there are different types of breast cancer and some of the rarer cancers which are less studied. Can you tell us a bit about your research and the work that you're doing in those rarer forms?
Thanks, Marina. I guess you firstly touched on that breast cancer is a heavily researched area, and I would like to point out that there is an element of pink fatigue where people feel like they've bought enough pink ribbons, and I've bought the water bottles with the pink lid, haven't you solved it yet? And one of the reasons that we haven't yet is because breast cancer is not really one disease. It's many different types of cancers that fit under this one umbrella, and some areas have been very well researched and other special types of breast cancer have been less well researched, and as a consequence we don't have really targeted effective drugs for those particular breast cancer types. And in fact we're only starting to learn more about them now. In the last 2 decades, we've really learned more about breast cancer or any cancer than we have in the previous 5 centuries. So we're really at a point now where we're generating a lot of information about different cancer types, and we can hope to take that forward. One of the ways that the research that we're doing here at UQ can support that is through the Brisbane Breast Bank, where we have been banking or biobanking little pieces of tissue from breast cancer surgeries that are surplus to diagnosis requirements, and we keep them in freezers here and supply them for research so that we can work on clinical samples to understand the clinical situation better and hopefully develop a better understanding and therefore better treatments for all of the types of breast cancer, not just the most common one.
And I think that's really amazing, with the Breast Biobank and, something unique that we've got here in Queensland and at the University of Queensland. And for women who are diagnosed with breast cancer while they're dealing with that shock of that diagnosis, to know that their cancer is then going to go on and be able to help women diagnosed in the future through the huge amount of research that can come from those small samples from those individual women. Fiona, I'm going to move on to you since you've been sitting so quietly there. Can you tell us about how your research is changing the breast cancer landscape?
So, as you can hear from the panel, our preferred method is that you find this early. And at that point, a surgeon can remove it and things are a lot easier. However, at the moment, people do develop cancers. And so what we do is we're working, there's drugs that work for things like breast cancer, like HER2, there's trastuzumab, there's CDKs now in ER/PR breast cancer, and the treatments have gotten really good. But what we find is that some people, when they go in, are either initially resistant to the drugs, or after treatment they develop resistance. And for a lot of people now, the women who've been through that breast cancer, their biggest side effect is fear of recurrence. And we now, because we've got so much survivorship, have a lot of women who actually live with metastatic cancer. And there's not really a lot of support for them. They kind of fall in between the different stages. And so we're working really hard we've found ways to reverse the resistance to the cancer drugs. And on the really good news, there's a new drug in breast cancer, which it's the antibodies that have already been working, they've tied little toxins on. So now the antibodies that target the tumours deliver these toxins into the tumour cells as well. It's just about to be approved on the PBS, and it just clears those breast cancers, and on the really positive front, it reduces all the recurrence rates. So the main aim now is take the drugs that we know work, make them much better, get past the resistance that people have, and have like the aim of survivorship where you can forget you had it. You just go in, you get treated, you're done, and you don't have to worry about it coming back.
Fiona, I think that's a really nice example because we know that, for you to talk about from that drug discovery part and then that whole pipeline through to getting those drugs approved on the PBS so that women aren't tens and $100,000 out of pocket for those treatments, that's a long game though. for that pipeline to happen. How do you stay motivated and still get up every morning to put on your lab coat and keep doing that work, knowing that there's a long time till you necessarily see those wins?
So first of all, and really good news for everybody, I've heard they're revamping the approval system on the PBS to speed it up. That was in an article like last week, so that would be really good. As far as staying motivated, like you, my heart broke watching my mum dying from cancer, and it never fixes. There's just a thing that's left when you've gone through that. But also we interact with a lot of people who are currently going through their cancer journey. And there's one woman, if we'd met in any other time, she'd have been my best friend forever. She's amazing. She's high energy, ex-solicitor, and has 2 young girls, and has put herself through more surgeries and more radiotherapy rounds than we've ever seen. We think it's actually the world record. She gets RT to keep her mets away from her lung wall. She's just had a surgery to keep it away from her jugular, and she just keeps going determinedly because she wants to be there for her girls. So when you interact with somebody like that, the effect on your motivation is that you have a failure to sleep at all. And when you say that trials, the people going on to trials, oh, well, they've got no hope. We actually see it the opposite. Her only option is if we come up with a trial, and we need to do it fast. So literally, when you talk about motivation, we're in a race. We need to get something to trial while she can still do the RT and surgery.
You make an interesting point there, though, also around, the PBS getting these drugs for all women to be able to access at limited cost. The PBS, the way our Australian system works, is very much around survival. If we give these medications, we get them to live longer, whether that's a few months longer or years longer? So we can have these effective treatments that get women to live longer, but that doesn't necessarily mean that they're living longer with good quality of life. Vanessa, some of the work that you're doing within the Queensland Centre for Gynaecological Cancer is looking at how do we have less invasive treatments or treatments that can try and optimise quality of life. Do you want to tell us a little bit about that?
One of QCGC's main aims was always to do less invasive treatments to women undergoing cancer right now. So we can't look at preventing it at the moment. We're treating women with cancer right now, and Dr. Obermeyer's main goal was to make it a lot nicer journey for patients going through treatment. So we've done many trials. We've got another trial coming up that's starting early next year, and it's called ANVU, and it's on the rare cancer, vulval cancer. And the original surgery for that is a groin node debulking plus removing the tissue affected on the vulva, and it's very barbaric. It's a horrible procedure. Quite often the patients would end up with big cysts in their groins. These would leak for months on end. So Andreas has been looking at ways to make that type of surgery more pleasant and not as awful for those patients. So we're looking at now, it's a randomised clinical trial. We're looking at 2-to-1, and 2 out of 3 will have regular ultrasounds on those groin nodes after having the vulval surgery, rather than going straight in and taking the lymph nodes. And by regularly ultrasounding, keep an eye on the size of the lymph nodes, make sure they're not increasing, and hopefully that will be a better treatment for women with vulval cancer. And we do that with the support of our partners like Cherish and things as well. So, yeah.
Fantastic. So for those of you who don't know, Cherish Women's Foundation helps to fund research. So there are charity organisation who helps to fund and provided some of the seed funding for that work, which then led to getting the larger funding for the clinical trial. Carlos, your career trajectory, which is going great guns, would have been very different for you if you hadn't had some early philanthropic funding. Can you tell us a bit about the impact that that's had for you?
I think it's important to also clarify that research also takes time, right? And take time not only because perform experiment engage patients, all take time, but also take funding. And that is probably one of the key factors for everyone here to perform and do research, right? So I came from Chile 12 years ago, only for 10 months, and it has been 12 years, right? That's life. And initially, you know, I have, in my second year, I couldn't get funded, actually. So I was ready to move on and go to a different country when I got my first grant from a philanthropic organization, which was the Lion Medical Research Foundation, which Diane, I think, is over there, which I'm very grateful, right? So, and I think we got that funding, which allows to perform our proof of concept, right? So what the Lions, and usually the philanthropic organization and the Ovarian Cancer Research Foundation later on, even private donors, they fund an idea, which is very hard to pitch with the main government organization, which they require to have a more mature data or idea to get more funding, right? So I think that is the key aspect of your support and the philanthropic support is essentially you are funding projects that are high risk, but potentially are high reward as well if that works. And that was my experience in Italy with the foundation, and the philanthropic organization. They found this idea, can we actually identify this cancer signal very early, right? And with that, actually the program started. And 10 years later, we have been able to secure from this initial seed funding over $15 million in research funding, profile this, engage over 5,000 women in our research program. And everything starts with this initial funding, right? The other thing that is quite attractive, because we have a great support here at UQ, is every single dollar that people donate is going 100% to research, which is great, right? So at least for me, and not only for me, it's just I'm the face of a multidisciplinary group. You help to essentially establish the program and build this program for the last 10 years, which have been fantastic for us.
I've got the song in my head from Little Things, Big Things Grow. I'm not going to sing it to you because that would be terrible for all of you, but that's what I've got in my head. And, you know, so we do see, you know, the huge value that initial seed funding can have. We saw that with Infraser and Gardasil vaccine, and we see that time and time again. Amy, you're quite passionate and vocal about the need for funding in terms of breast cancer research. Do you want to talk to us a little bit?
Yeah, of course. So as Carlos mentioned, research does take a long time. And if you're working in clinical samples to really formulate the ground knowledge that we need in order to develop new treatments and understand the different types of breast cancer, this kind of research takes decades. We need to be able to follow a patient and know what treatments they've had and then work out what the outcome was. So this is looking at sort of 10 to 20 years of follow-up data. It needs to accumulate and mature before you get the return on the investment there. So there really is this there is a delay on investment in true clinical research. It's not a short-term fix where at the end of a 3-year grant cycle we've understood the cancer, we've found a target, got the drug, and it's cured. It's not going to happen in the typical granting cycle. So the funding investment in this clinical research needs to be sustained, and we need to be able to keep people in roles so that we don't lose their amazing wealth of kind of corporate knowledge in their discipline. And historically, scientists have moved around a lot in different labs, countries. All of us here have worked in a number of different places, but in order to make a really deep dive on a particular topic, you really need to invest time and money to solve those big issues. And I think, especially in the discipline that the broader team that I work with and I around biobanking, really need a sustained infrastructure investment there too. As the biobank matures, you get a lot more samples, you need a lot more freezers, you need people to look after the freezers and manage the databases. So as it expands, the costs increase.
And I think, You know, what I want to acknowledge though here is we are at the University of Queensland, which is a very large institution, and we need to acknowledge that UQ provides all of these glorious, wonderful buildings, TRI, UQCCR, the facilities that our researchers do have, and pay for many of us to do our work. But that money can only ever stretch so far, and the more, as you say, Carlos, you know, you have these ideas, these potential ideas for where things can go, that's where we need that extra investment. And so, you know, the amazing work that all of you and all of your research groups have been able to do is based on that collaboration between the university, philanthropy, industry, and government in terms of seeing that the outcomes from that research.
Just additionally to that, I just wanted to mention that the more money we get, the larger the clinical trials can be, the quicker we can get the answers, because we've got such a large number of patients providing us with data and evidence and what's happening in clinical trials. So every little bit of money helps. Community investment, every little bit helps. So that's the most important thing, is that if we can keep the funding going, as you say, they run a really long time. So
Vanessa's trying to take my job here and do this beautiful summary and wrap. So, to wrap up, I'm conscious of time as well, because we want to give an opportunity if there are any questions from the audience. Can you, each of you, share with us, what are you most excited about in terms of the future of women's cancer? Vanessa.
I just love the way the world is headed at this point. Women do speak up for themselves, they're more aware of their own bodies, they have a bigger voice than they used to, and I think that's really going to help in the long term when it comes to early diagnosis for cancers.
I'm quite excited. I'm for several reasons, right? But probably one of the main things that is happening in our research program at the moment is we just received a large grant from the NHMRC, which is actually a partnership grant, which probably reflects what we're doing this today as well, right? As a given day. So this particular grant, essentially, the NHMRC matched the funding that you have, and we have two main partners, which is the Lion Medical Research Foundation and the Ovarian Cancer Research Foundation, and the NHMRC matched this contribution from our partners, which is a clear example of actually where this partnership can lead to, right? So we're very excited that we're going to start a project to trying to trying to get data to implement our ovarian cancer test in the clinical practice, which is fantastic. So we are very excited about that. The other thing, looking for the future as well, is we're very excited to actually identify. We know that early detection saves life, but how early is early enough? Which is a very simple question, right? So 1, 2, 3, or 4 years before to the clinical symptom, how early is early enough actually to increase the survival of women from ovarian cancer? Ovarian cancer takes around 5 to 7 years to develop. So when women were diagnosed with ovarian cancer, it's more likely that the cancer starts 5 to 7 years before that. So give us a clear timeline to where we have to intervene and trying to identify these women. So we're very excited with what's going to happen with us for the next 5 to 10 years.
I'm really excited about the possibility of overlaying precision medicine over our current understanding of population medicine. So at the moment we treat breast cancers as a group. We don't really individualise a huge amount, but the breast cancer patients are a little bit like a number and applied to a guideline. But with the advent of genomics technologies, and we're looking at liquid biopsies or taking a blood sample to monitor a patient specifically, their tumour mutations, we have this capacity to overlay personalised medicine on the top of the population medicine. So I think it's a really, really exciting time to be a researcher.
So really excited about two things. The first is that a lot of the new therapies coming through work better, and they'll lead to better survivorship, better quality of life afterwards as well, and less recurrence. That's fantastic on every single front. The other thing that's exciting is all the things that we've learned in the women's cancers and how to make those drugs work can actually be applied across all the cancers, so prostate, colorectal, head and neck, pancreatic. There's a real change in the field. Science is moving really, really fast, And I've been able to, for the first time ever, tell my third-year undergraduates that I think by the time they're like my age and over 50, cancer won't be such a worry as it is now.
So you've heard from 4 of our researchers around what they're excited about. We're just going to play you a video of something we prepared earlier. We have many researchers in UQ, women's cancer researchers, not just us here, and so we asked them what they're excited about, and Tasha's hopefully going to play that video now.
My inspiration is from growing up in regional Queensland, where I observed firsthand the differences in cancer care options and support available for my family members compared to those living in major cities.
I lost my mother to cancer, but every week we now see women going through their journeys and surviving and being clear of it, all as a result of research.
Gynaecological cancer is not often spoke about and doesn't receive a lot of funding, but women with this cancer diagnosis deserve a lot better.
What inspires me is connecting with patients and understanding their journey and meeting survivors and seeing their passion for the cause. That really grounds me as a scientist who's often stuck in the lab, and just seeing our research affect other people's lives is a real inspiration to me.
My daily interactions with patients inspire me massively. And the knowledge that we could do so much better than we actually can do at the moment also inspires me tremendously.
My greatest hope for the future is that we can either cure cancer or make our therapies work better so that our patients get better treatment options and we can address that fear of the cancer coming back or recurring.
My greatest hope for the future is that we can reduce the number of women dying from ovarian cancer, and we can do that by preventing ovarian cancer in the first place, but also making sure that women receive the best care.
My greatest hope for the future is that a woman who is diagnosed with a gynaecological cancer can have the best treatment that is given to her, so that she can pretty much be guaranteed that she will respond to the treatment and have the best outcome.
Well, my greatest hope is that we will be able to translate some of the scientific discoveries that we're making every day for the benefit of patients, so that we can reduce the burden of disease in the community, and for those who are living with disease, that they're living a much better life.
My greatest hope for the future is that receiving a breast cancer diagnosis won't be the life-changing diagnosis that it is today, and we will treat it as in the same way as we manage receiving a diagnosis of high cholesterol or hay fever.
My hope for the future is that every woman diagnosed with vulvar cancer will get the best survival outcomes possible.
My greatest hope for the future is that we generate all the knowledge and tools we need to control this disease.
My greatest hope is that our research can promote the development of new therapies readily available off the shelf for people that are sadly diagnosed with these hard-to-cure cancers.
My greatest hope is that all Australian women diagnosed with gynecological cancer and their families are supported throughout the cancer journey, no matter their age or where they live.
My greatest hope for the future is a great scientific discovery that will not only keep women alive, but will also improve their quality of life.
My hope for the future is that my daughter won't have to worry about women's cancers.
Please join me
in helping the woman we love
through a donation to women's cancer research today.
Your generosity will help change the future.
Thank you very much for your help.
Thank you.
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 So I'd like to add to what they say and say I'm most excited about a future where no other woman has to suffer like my mum did, and that's the case for all women regardless of where they live or their background. And on that note, I'd also like to acknowledge Breast and Prostate Cancer Association of Queensland, who have donated money to our research in the School of Public Health, where we're looking at addressing regional disparities that women face with breast cancer, particularly in those regional areas and not just in the remote areas. And Breast and Prostate Cancer Association of Queensland are our matching partners for this Women's Cancer Research Giving Day, along with Women's Cherish Foundation, who've been long-term partners with the Queensland Centre for Gynaecological Cancer, as well as Christine Nicolaides, who has designed and created these beautiful earrings. And you'll spot Christy because she's also wearing matching earrings. So she's created these earrings especially for this event, and all proceeds from the sale of these earrings will go to Women's Cancer Research. And just so you can all look as glamorous as Christy and I do with your earrings, she's also donated a pair of earrings as a lucky draw prize. Christy, are you going to come up and pick the raffle? Do you want to? Jeff, you can do that for us. Make sure.
So green C606.
Green C06. Who's the lucky winner? Come on down. Jeff, you've missed out. Thank you very much. Thank you. Now, before I forget, we have got some time. Carlos, I've been looking at your watch. Are there any questions from the audience before we wrap up? You got a chance to ask these fantastic researchers any questions, or did they just bamboozle you with all of their... I think Carlos should be a politician. Yes.
Oh, thank you. Hi, my name's Claire. I look after the Queensland Advanced Breast Cancer Group. So it's a group of ladies who meet every week with a psychotherapy-led support group, and they've all got metastatic breast cancer. I would love to be able to take a message back to them about what would you say to them would be the greatest thing that I can tell them to feedback that they have to look forward to in the future. So the same theme of your biggest hope. They're full of hope. I'm here on behalf of them. So what can I go back and tell them?
So I have the advantage of just having read about 50 different grant applications from around the country. And the good news is that a lot of those applications now have swapped, and it was really interesting. A lot of them are centred around women now living with metastatic breast cancer. So now that we've got everybody surviving, all the drive now and all the applications are swapping to now helping those surviving women, exactly the group that you're talking about. So I think by next year, they'll be getting approached from every direction, from every university, because it's been realised that there's a gap in support there.
Yeah, absolutely.
I'd just like to add, please take back that they're not forgotten. I know that there's a general thought that women with metastatic breast cancer are the elephants in the pink room, but we're certainly doing our very best.
Thank you.
And I'm going to add to that. Because Claire, so what we're doing, a lot of the amazing work that's being done and the resourcing and the support, and we've talked about drugs getting onto PBS, is all around treatments. And those treatments treat the cancer. Supportive care and the work that allied health professionals do, and the work that your group does, looks at the whole person. And so we're in the process, and we had a story on ABC News last week, where we're recruiting women from across all of Queensland, not just Brisbane, all of Queensland, to take part in our clinical trial where we're looking at a diet and exercise program to support those women. So we know that these women, when we spoke to these women, the number one thing that they said to us that's most important to them is my physical functioning. I want to keep doing everything that I'm possibly doing for as long as I possibly can. And so we've designed a program. The important thing for that is our muscle mass. We know that as we all age, we're losing muscle mass, but you throw in an advanced a metastatic cancer and a whole heap of treatments, and you get that accelerated muscle decline, and that leads to a whole heap of deterioration for those women. So our program's designed to try and support those women over a 12-month period, giving them access to a dietitian and exercise physiologist, and allied health is cheap in comparison to these medications. And that's all delivered over telehealth so that women, regardless of where they live across the state, have access to that. So I'll chat to you more later.
Thank you. Great.
Any other questions?
Thanks, Marina and panel. You just talked about, providing care to women all across Australia, all across Queensland. What about our minority groups like Aboriginal Torres Strait Islander? What's going on in the research sphere for them?
So we have within the School of Public Health, Professor Gail Garvey is leading a huge program of research in cancer survivorship and the leader globally in that space. That's not just breast cancer, that's all cancers. And so, we're really fortunate to have her spearheading that and working closely with community to understand their needs and understand why there are delays in diagnosis, why we see that gap. So definitely doing lots of work in that space to address that. Any fun? Yes, Carla.
Hi, thank you. My name is Carla. I lost my mother to breast cancer as well. So I would like to thank all the panel for your amazing discussion. As a migrant myself, I would like to ask Carlos. I'm from Bolivia. Hola, Carlos. Mucho gusto. Just what inspired to come here to Australia and do this work? What was your background in Chile? Chile is a very advanced country in South America and doing amazing things in the medical field. So what inspired to come to this country? And also, I wanted to ask you in general if there is a program or a project to cater for migrant women that don't have the Medicare, so they can be covered under that. So, thank you.
Thank you, Carla. One of the reasons that I actually came to Australia is was a little bit of luck and coincidence, right? I was doing my PhD in Chile, and my supervisor had a collaboration with an Australian professor, right? So I remember that my supervisor called me one day and said, Carlos, can you please go to pick up this person to the airport, right? And as a good student, you need to do what your supervisor asked you to do, right? So I did that, and I have a great time with that particular person. And he was a professor here at UQ, doing some proteomic analysis, just doing identification of proteins, right? So that was my first connection with Australia, right? And that is probably a good lesson for everyone, because you don't know when the opportunity will show up, right? And we still in contact, but by then we kept contact for over a year, and finally an opportunity showed up about to come here to do an internship for 10 months, the last part of my PhD. And I was, come here, I'm doing my work, and then a position at UQ was open, and I got that position, and that is the reason I stay, right? Obviously, when you come from overseas to this particular country, the country is beautiful, but I think it's the people. You can replace everything. You can replace the building, you can replace the equipment, but something that you cannot replace is people. And I feel that, especially here at UQ, they have the correct environment for people like me and Amy and everyone flourish according to their skills. So that was very valuable for me. And then obviously you have this great interaction with hospital and clinician as well. And this is super important, because it takes a multidisciplinary team to trying to achieve your goals in research. And we have, especially I'm based in the UQCCR, we are connected to the Royal Brisbane Women's Hospital, which is the largest hospital here in Queensland, not only in Brisbane. And UQCCR is just one example. So we have the TRI, we have amazing facilities. So the environment, I thought that was the correct one for me. And also UQ and the people, they received me with open arms. So how I can live now, right?
I'm going to address your last point, Carl, which is a really important point around how do we support migrant refugee women. There's been a lot of emphasis. We talk about these minority vulnerable populations, and rightfully so in Australia we've privileged and focused on our first people, those in regional remote areas who aren't in major cities. Last year was the first time we've had an Australian cancer plan, so the first national cancer strategy that we've had in this country. And what that cancer plan's really pulled out is priority populations. And culturally and linguistically diverse populations are a key population that we need to address. Some of the work that we do in the School of Public Health, I work very closely with epidemiologists and Associate Professor Susan Jordan, who you did see in that video, but unfortunately the birds didn't listen to Melissa and Lucy and were very noisy in the background when she was speaking. So Susan has got access to currently a data set where we pull administrative data, so it is largely linked to Medicare. So in that data set, they are having to have Medicare, but it's pulled data set of 12 million women from across Australia, where we can then use that data to look at delays in diagnosis. We can look at their treatment pathways. We can ask a whole heap of questions. And so what we're looking to do now is to build that data set even more, to link in with some other data that the government has, where we can then try and narrow down more specifically on some of those priority populations, like those cold groups, like women with disabilities, and really try and make sure that we raise the bar for everyone. The biggest problem for us in this country is that all of us, and I'm assuming most of you here, most of us are privileged. Most of us live in a capital city. Most of us aren't dealing with the same economic burdens that so many other Australians and Queenslanders deal with. And so what we need to do is raise the bar for everyone. If we raise the bar for everyone, we all flourish. It's not about some people getting more than others. It's around us all, elevating all of us. Okay, I'm conscious of time, so I think we're going to wrap up there. I want to thank you all so much for joining us this morning. It's so lovely to have so many people in the room. We know it was an early start, so thank you for braving the morning traffic and getting up early to join us here. I hope you found this discussion useful and given you some insights into the cutting edge research that we're doing here at UQ and that we continue to do and we hope to do many years into the future. And I hope it's also highlighted for you the value of philanthropy, no matter how little or big, the impact that can have on the work that we're doing and the importance of that partnership between us as researchers and our community partners in making sure that we answer these key questions and we ultimately get to this future that we're aspiring to. Before we wrap up, I'm going to ask we have wonderful novelty big checks from our matching partners. Is Glenda just about to leave though? So we were going to ask our partners to come up just to get a photo. So Christy, that does mean that you have to get up. But thank you all so much for your time this morning. We do also have, I've got in the front seat here, Dr. Gertrude Behan from the Mark Hirschfeld Museum, and you would have seen some of the artefacts from the museum in the glass there. They're doing some work where they're wanting to record and capture people who have a history and experience with this beautiful building that we're in. If you do have and you'd like to do a 20-second audio snippet, please come and have a chat to Gertrude at the front here at the end. Okay, so Glenda, you've come back for us. Oh, Jeff will pay. If you get a fine, Jeff will cover that for you. Okay, thank you all. Glenda, Christy, and who's here from Cherish? How have we got? Okay. So, Giving Day is today. We are doing, so any donations that you make are matched by UQ and our matching partners, and that matching will end today, end of the week, midnight. So you've got till midnight. Any donation you make, you'll have on the materials that you've got there the link for making those donations. Any donations you make will be matched dollar for dollar up to $10,000 by UQ and our matching partners. Thank you all so much for joining us.